so much for that lovely introduction, and I love the enthusiasm. I was loving your analogy before about the wheel because it has so much overlap with sort of Eastern medicine energetics, and I think you'll hear some similarities as I start to talk. So as we move through this, and we've had so many great talks and points made so far, so I'm going to be speaking to you about how Chinese medicine looks at hormonal issues and specifically PCOS. I'm just going to share my screen. Hang on one sec before I forget to do that. Here we go. Okay, perfect. So exactly. So we're going to be looking at a holistic approach to PCOS and hormonal issues with Chinese medicine. I'm going to figure out how to turn my page now. There we go. So I won't go over my bio because that was such a great introduction. So the couple of points that we're going to focus on is what is PCOS and how does it impact fertility specifically. I'm going to be defining PCOS and hormonal imbalance as how it's looked at in Chinese medicine. Then I'll be going over sort of the pillars of traditional Chinese medicine. And just a real quick side note, wherever you see the term TCM, it's just the abbreviated version of traditional Chinese medicine because it is a little bit of a mouthful. So it saves me from having to repeat it too often. And then we'll talk about treatment with acupuncture, herbal medicine, and Eastern nutrition, and then how it all comes together with holistic and integrative support. And then at the very end, some of the really profound clinical research that's out there supporting all of this. So as we talked about before, and Dr. McConnell gave such a great Western introduction of all of the science and the physiology behind PCOS. So we know that it's a chronic gynecological syndrome that has various factors that can be present. Some of the things that we see are things like cystic acne, irregular periods, no periods. There can be either hair loss or excess hair growth on the body. There can be infertility and weight gain. Now, one of the things that I just want to point out is that not all of these factors have to be present. In fact, there are a lot of cases where only some of them, which is essentially one of the things that make it so tricky to truly diagnose PCOS. And as actually Dr. McConnell pointed out, a lot of the big diagnostic criteria is around requiring 2 out of 3 of either presence of cysts, elevated androgens, or insulin resistance in order to get a true PCOS diagnosis. From what I've seen, I don't often have that perfect textbook case. In fact, most of the patients I've worked with in the last decade are a bit more of a different presentation as women that are more over-exercising, much more on the thin side, or even a little bit underweight, very, very high stress, a little bit of a type A, and they come in presenting with either no periods or just very irregular long cycles. The statistics say that around 1 in 10 women will be diagnosed with PCOS in her lifetime. I would say from clinical practice, it seems a bit more on 1 to 5. So it's seeming, unfortunately, more and more common. And then we also know that it's one of the leading causes of infertility. And so what we know with the fertility factors, when we're talking about fertility, women with PCOS often have trouble with conceiving, essentially because they're not really sure when they're ovulating. They may not be ovulating. A lot of the at-home ovulation predictor kits that are being used aren't going to be accurate because their LH levels are going to be elevated all the time. So you might be peeing on sticks for 27 days straight, and it might look like you're constantly ovulating, but it's not the fact. It's not exactly what's happening. And so it makes it very difficult to conceive. The other factors that circulatory aspects can impede the health and the quality of the egg, so that there's a bit of an egg quality issue. So from the Chinese medicine perspective, hormonal balance is an incredibly complex and delicate interplay of what should be high and what should be low at any given time. And that can vary from hour to hour, day to day, month to month. And these normal ebbs and flows are what help perpetuate a healthy endocrine, metabolic, and reproductive functioning. It's when those mechanisms become faulty, though, it's when those mechanisms become faulty, whether from predisposition, such as genetics, or environmental factors, from diet, from stress load, from medication use, various exercise habits, and trauma or illness that disorder can develop. So in TCM, hormonal balance is closely tied to the concept of yin and yang balance. I use this example at the risk of it sounding very expected, but it does underlie a very simple and complex notion of equilibrium. And so although yin and yang are opposite in nature, they depend on one another to function properly. Hormone balance occurs when the yin and yang interchange smoothly, making room for change and transformation, much like it's important for estrogen and progesterone levels to be balanced in a woman's cycle in order for menstruation to occur. So with PCOS and other hormone imbalances, these natural shifts are not occurring because of disruptions to the functioning of the body's homeostasis, and more specifically to what we in TCM look at in the functioning of the organ system. So one of the main ways we diagnose and treat in Eastern medicine is by looking at the root cause of hormone imbalance based on the identification of essentially pathological processes within the organ system. And so this is the part I'm going to go over a little bit more, so use as an example. So for instance, the way the liver operates in Chinese medicine is very different from Western in that the liver regulates all hormone messaging as well as the body's circulation. And so this can include the movement of blood, the movement of energy, the movement of lymph fluids. The kidneys themselves are responsible for our reproductive capacity. One of the reasons is that they're known as the source of the body's essence, so essentially our genetic blueprint. And along with that, they also regulate fluid metabolism. The spleen is in charge of assimilating and metabolizing all of the nutrients that we take in and separating what's called the clear and the turbid, which in Chinese medicine is a term that means utilizing the good things while getting rid of the bad from our system. So one of the common pathologies I see in practice when it's specific to PCOS is what we call a stagnant liver, a deficient kidney, and spleen. And so what this means is that the hormone messaging system has been disrupted or stopped. And you can reference this to that break in the hypothalamic pituitary ovarian axis that happens when ovulation is stopped or delayed. Then you have fluids that are not distributing in a healthy way, and the turbid or excess fluid is collecting from poor circulation due to an overburdened liver. And then this is leading to fluid, or what we call dampness, stagnation, and accumulation in the reproductive tract, which for women, unfortunately, is the area of most vulnerability when anything goes awry. And then this results in cysts. So this is just one example of the pathological mechanism, and there are definitely many others. It can get quite complicated, so please don't worry about understanding it fully. Ultimately, it's more important that your Chinese medicine provider does. I do find, though, that it can be helpful because you can have a sense of how there are very interesting similarities to the organ physiology that overlap with Western, especially in regards to PCOS. So for instance, the functioning of the liver, which is in charge of proper detoxification processes, that can impact hormone regulation. And then you have kidney energy depletion as it relates to burnout, which also can lead to hormonal imbalances as well as metabolic issues. And then you have spleen energy depletion as it correlates with improper metabolism with underlying gut issues and with weight gain. So how do we treat this in Chinese medicine? Now, holistic care means addressing the root cause, as I mentioned, and that happens by treating the whole person to restore you to your ideal state of health. And so when you consult with a Chinese medicine practitioner such as myself, we dig really deep with a complete detailed health history, and we're looking for all of the underlying causes that can currently be contributing to the hormonal issues and essentially preventing optimal health. Now, it's important to know that hormonal issues and even the manifestation of PCOS have been treated for literally thousands of years with acupuncture and herbs. And in as early as the 12th century, there were Chinese medical texts that identified PCOS and described it as what's called the Tiangui, which in sort of Asian philosophy refers to female essence, which is comprised of the hormonal system and even the menstrual cycle. So it's really quite cool when you look back at how long ago we had presentations and manifestations of exactly what's happening right now that women are still struggling with. It's just showing up a little bit differently. So holistic also means utilizing all of the tools available that can impact a person's whole system. And in traditional Chinese medicine, we have the 3 pillars, which here are acupuncture, herbal medicine, and Eastern nutrition. So with acupuncture, it's been shown to profoundly affect the reproductive organs through mechanisms in the endocrine system and the sympathetic nervous system. So when needles are inserted into certain points and stimulated, it produces a neurological reflex transmitted to the organ correlated with that nerve pathway. Acupuncture is also powerful for reducing inflammation and improving blood flow to the reproductive organs. And it does this by stimulating the parasympathetic nervous system and thereby redirecting blood flow to the pelvis. So in treating women with PCOS, one of the main goals of acupuncture, in addition to the actual endocrine support, is to improve hemodynamics, which is blood flow to the ovaries and to the uterus. And then so this can help improve egg quality by nourishing the environment in which those eggs do all of their development and maturation. And so then with healthy circulation, you have better hormonal signaling reestablished. You can have irregular absent menstrual cycles that are corrected. Ovulation is now regulated, and pregnancy, where intended, can be achieved more easily. So with herbal medicine, Chinese herbal medicine has a really long history of treating gynecological problems and infertility, and therefore is a very effective way of addressing PCOS and hormonal imbalances. Herbal formulas are a very specific combination of plant and mineral compounds. They're selected specifically to restore organ imbalances unique to each patient. For that part, it's important to know that Chinese herbal formulas work best when they're customized. And really, this is one of the reasons it's best not to take herbs unless you've been advised by a skilled practitioner, because it's not only that it may be less than beneficial, but it could also be harmful. You can actually take too much of one kind of herb that can really impact the functioning of your liver, and now you're essentially doing the exact opposite of what you want to happen. So definitely always consult a licensed or certified herbalist if you're going to be looking at taking herbs. So in clinical practice, I've seen profound benefits and changes in women's cycles with the incorporation of Chinese herbs to the treatment plan. Deep hormonal imbalances such as PCOS, endometriosis, fibroids, perimenopause, and even PMDD, which is premenstrual dysmorphic disorder, which is just a very intensified version of PMS that has a lot more emotional imbalances such as anxiety and depression and much deeper. They all respond really well. You know, we have the regulation of menstrual cycles and ovulation. We see reduced heavy bleeding. We see a lot less pelvic pain. And we also see healthy pregnancies and just improved quality of life. So the important thing too is that herbal medicine can work synergistically along with getting regular acupuncture as well as on its own. And I actually work with a lot of women remotely for herbal consulting and just ongoing support that way when they're not within any sort of reach, and also during pandemic as well. And honestly, there's a lot of really severe cases that respond well to just doing herbal medicine. So that's always an option. Now, Eastern nutrition is really interesting actually because it looks at the energetics as, it looks at the energetics of food versus its essential nutrient profile. And so this is not in contradiction to how Western nutrition looks at food, but rather it's complementary because it's looking at a different layer of influence. And so dietary focus emphasizes warm cooked foods in order to ease the burden on metabolism and support healthy circulation in the pelvis. And this often helps offset and prevents the accumulation of these fat fluids that I mentioned before, which can start to build up and impair functioning and then lead to cyst formation. So food is really meant to not only heal, but lessen the burden. And so I put up some examples for you so you can see based on the organ systems that I mentioned before that tend to be affected in terms of their functioning, what kinds of foods are very specific to their nourishment. There's a really interesting sort of a law of signatures that we follow in Eastern nutrition where like treats like. So you can often look at, if you look at a lot of the root vegetables that are orange, such as carrots and pumpkin and squash, that orange association aligns with the earth element, which is spleen. And so that's how you know how to nourish that organ. Similar with the liver, a lot of the dark leafy greens align with liver, which is wood, but it's sort of like fresh green wood. And then kidney is this deep dark blue of the water and the ocean, the ocean and the water element. So things like blackberries and black beans and lentils and things like that are very nourishing. So what is holistic and integrative support exactly, right? So we already talked about a lot of the great holistic factors that can influence overall health. And some of the other things that I like to incorporate are supplements. I definitely use a lot of really well-researched supplements, and you know, it's based a lot on clinical practice and what I've seen success with, but also on just ongoing research, which I'm constantly obsessively reading about. So I just list for you a handful of the ones I more commonly use. These are obviously very specifically tailored to each unique woman. So I by no means add all of these to one woman. The dosages are going to vary. So really this is where it's appropriate, but I just wanted to illustrate some of the things that are commonly known, only in that the research is really strong. For instance, N-acetylcysteine is very profound in that it has similar benefits to metformin in that it's able to improve fertility success rates. It helps with insulin resistance, and it acts as sort of a mood enhancer in a funny way. Vitamin D is also really great for mood and improving fertility. There seems to be a prevalence of low vitamin D levels in the PCOS population, so this one is a good one to factor in. Lifestyle recommendations, of course, are always really key, especially with something like PCOS. Over-exercise tends to be more common from my patient base, oddly enough. And so it's finding that sweet spot where you're getting enough movement, but you're not burning out your adrenals because you're overdoing it. It's getting enough movement and getting it very regularly. So something more of like 30 minutes a day, 5 days a week is much more effective for most PCOS presentations, as well as finding ways to help manage stress like meditation, journaling, breath work. You know, all of this is really helpful for calming that parasympathetic nervous system. You know, developing self-care habits, working on work boundaries, sleep hygiene are really key. And then also in most cases, if they've not done so already, I will refer a patient for further testing and diagnostics so that we have a much clearer picture of what lies underneath. This is especially helpful in cases of women that are trying to conceive. So here I just sort of listed a couple of the things that I like to look at. I've had a little bit of a functional medicine training as well, so I can interpret the data. Now, I just want to point out, though, that it's not absolutely necessary to get the lab work because ultimately, like I mentioned before, Chinese medicine has been treating complex gynecological disorders for thousands of years now without any labs, but we are evolving as an ancient medicine, and it is the modern world, and we are adapting our healing toolkit to be as mindful and comprehensive as it can be. And so, you know, it's here that integrating that East and West can be really beneficial in propelling all of our efforts forward. And so I'm going to leave you with some clinical research to look at on your own. It's really quite amazing when you see the wealth of data that's out there for how incredibly profound the effects of integrating things like acupuncture and Chinese herbs, either both together or separately. And so there's a lot of good research there. This is just 4 of the more recent studies that I pulled up. So you're welcome to read into them. I've got the references here. And this is just my contact info. Yeah, feel free to reach out if you have questions about anything. And you can also just find me on social media.